electroneuromyograph with an option of brain-evoked potential study, Neuromyan, is manufactured in 2, 4 or 5 channel modifications with different software versions, which provide both inexpensive and elite expert class devices. The sales package contains a remote controller with an option of work with electrodes of electrostimulator, which allows regulating stimulation parameters and makes it easier to carry out standard tests without using PC mouse or keyboard. The remote controller contains connectors for electrodes attachment located on the front part, stimulation area, encoder, wheel regulator, selection area. Wireless foot switch is meant to control stimulation and racket modes, making your hands free to work with electrodes. For EMG studies, the following electrodes are required: EP recording electrodes, a grounding electrode, EMG electrodes, cup electrodes, finger ribbon electrodes, alligator clip adapters to disposable electrodes, surface electrodes with fixed inter-electrode distance, stimulating electrodes, electrode with felt pads, stimulating bar electrode with a handle, electrode with a steel stimulation point for children and adults. EMG study techniques play a key role not only in the diagnosis of neuromuscular diseases, but is successfully applied to monitor the effectiveness of the therapy, orthopedics, traumatology, neurosurgery, and other areas of medicine. Process of MCV measurement begins with the selection of studied nerve and stimulation points. The software provides a wide range of settings for each test. Oscilloscope and monitoring of electrode impedances ensure that the signal of use channel has no disturbances and allows controlling the study quality. Signal window with M responses from distal and proximal points. Markers are set automatically on each received M response. The calculated parameters window contains 2 tables with automatically calculated data. Study of F-wave latency characterizes nerve conductance at proximal nerve level. F-wave is usually recorded after MCV study. Therefore, the stimulation points, racket points, and stimulus level are already detected. On completion of the work with the markers, the calculated parameters table contains time and amplitude characteristics of all responses, and the main data table shows integral indices on the aggregate of all responses. Histograms of latency and amplitude distribution and visual analysis of F-waves by the superposition method are provided for additional analysis. Sensory conduction velocity study is required for early diagnostics of peripheral neuropathy, adjustment of racket conditions, stimulation conditions, and split parameters, racket of sensory nerve potential, integral tables for carried out techniques compactly represent the number and results of the test that allows a physician to ascertain the need for further tests and choose the type of these tests. General protocol is automatically generated for all the tests after analysis and comments on the techniques. Print Manager unites all the obtained results, signals, calculated and integral parameters, and physician's comments on each test into one output document. Tunnel syndrome is a complex of clinical manifestations caused by compression, nerve entrapment in narrow anatomical spaces. Inching differs from nerve conduction velocity study in the fact that inching uses from 8 to 10 short segments of 1 cm long. Electrodes, racket technology, racket and stimulation parameters are the same as for motor conduction velocity study. The study of the sensory conduction is carried out by stepwise stimulation, with the nerve impulse directed from the periphery to the proximal parts. Study of the sensory conduction is implemented in the orthodromic and antidromic techniques. Ash reflex is a monosynaptic reflectory response of a muscle to the electric stimulation of mixed nerve-sensitive fibers. Ash reflex parameters are used to assess the functional state of the segmental apparatus. The software provides viewing test results both for all tracks and for each track separately. Main data for the analysis are presented in the form of graphs of H and N responses amplitude dependence on stimulus intensity value. Record and stimulation parameters, integral tables data, and test conclusion are automatically included in the comments of general protocol. Blink reflex study is carried out with a stimulating EMG technique based on the record of motor response of the eye muscle arising from stimulation of the first branch of the trigeminal nerve, recommended for the diagnosis of facial nerve neuropathy, test recording, automatic settings of the markers, and filling of the automatically generated table of calculated parameters. For the differential diagnosis of myasthenia and Lambert-Eaton syndrome, as well as for the diagnosis of botulism, multiple sclerosis, and other peripheral motor neuron diseases. Automatic implementation of the test according to a predetermined scenario. Stimulation scenario contains the most frequently used functional tests: a basic test, standard test, maximal voluntary contraction, relaxation or post-tetanic relief, post-tetanic exhaustion, and user test. The main data table is meant to monitor dynamics of response parameters between functional tests. It can also be used for traces navigation in signal window. Interferential surface myography technique allows studying summarized bioelectrical muscle activity at rest and in different tension modes. Used to diagnose the following conditions: primary muscle lesions, lesions of the anterior horns of the spinal cord, supraspinal locomotor activity disorders, and others. Surface EMG technique has its own channels configuration setting, which defines the number of channels used, the names of the muscles studied, synergic and reciprocal relationship. Surface EMG recording in inactive muscles. Surface EMG recording in a state of maximal voluntary biceps contraction. Surface EMG recording in a state of maximal voluntary triceps contraction. List of saved functional tests is formed in the window functional tests list. This window is used for navigation in the functional tests carried out. To the current functional test selected from the list, signal window is called automatically, and functional test parameters are shown in the main data table. Record and stimulation parameters, integral tables data, and test conclusion are automatically included in the comments of general protocol. Used for differential diagnosis of myopathy, progressive muscular dystrophy, traumatic lesions, neuropathy, motor neuron disease of a spinal cord. With the help of the PC mouse, the researcher selects EMG area and goes to MUP window where marker's position is corrected. Selection consists in successive fragment selection from the recorded ones in the Save Data window and saving them in MUP buffer. By the end of the study, test conclusion is automatically generated and then can be enlarged by a doctor manually. Print Manager unites all the obtained results, signals, calculated and integral parameters, and physician's comments into one output document. The method of evoked potentials is used to study the function of sensory systems in the brain and brain systems responsible for cognitive processes. EP study is indispensable for early detection and prognosis of neurological disorders in stroke, consequences of traumatic brain injury, and other diseases. EP study allows intraoperative monitoring the functional state of the central nervous system during surgery. Used for diagnosis of acoustic neuroma, tumors of the brainstem, the objective assessment of hearing. The technique is meant for the record of auditory EP with latency up to 10 milliseconds with automated amplitude. The software has a convenient semi-automatic algorithm of an individual hearing threshold selection. Summarized sound level and hearing threshold set for a patient should not exceed maximal volume of phonostimulator used. Used to evaluate the prognosis for the functional safety of the eye with severe traumatic lesions, hereditary eye atrophy, assessment of damages under various visual cortex, assessment of visual function in patients with impaired consciousness, and so forth. Flash of white light of LED matrix is used as a stimulus. Stimulation and racket parameters are set for each specific case. The superposition of signals and comparison of the test 1 and test 2 results. Used for the diagnosis of multiple sclerosis, compression lesions of anterior visual pathways, assessment of optic nerve state at various neuropathies, and others. A great number of stimulation settings for the test: montage, stimulus type, stimulation site, element size, fixation point, fields, selection of stimulation pattern type. Testing process. The superposition of signals and comparison of the test 1 and test 2 results. Rapids for printing. Used for diagnosis of multiple sclerosis, brachial plexus injury, spinal cord injury, as well as diagnosis of neuropathy, coma, and brain death. A great number of test settings. Settings for stimulation conditions, settings for racket conditions, montage. The results and test conclusion are automatically generated by the end of the study. Present-day development of electronics and wireless technologies provide quality record of myographic signals and evoked potentials and guarantee comfort for a doctor during studies carried out.